afternoon, everyone. Thank you all so much for coming out this afternoon, for spending some time on a Tuesday afternoon with us here to celebrate the Protect Our Healthcare Coalition's campaign for healthcare access and affordability. We really appreciate everyone being here, members of the Assembly, and everyone else in the audience here. I want to introduce myself. My name is Shamus Durac. I am the Senior Attorney and Health Policy Analyst with RIPIN. RIPIN is a consumer nonprofit founded in 1991 by a group of families of children with special health care needs to assist families in Rhode Island navigating educational and healthcare systems. It's evolved a lot since then. It is now employing more than 100 Rhode Islanders, navigating all sorts of systems across the entire lifespan from early childhood to older adults. We operate a number of programs helping people navigate education, special education, care management. We operate the state's Consumer Assistance Program for Health Insurance in partnership with the Office of the Health Insurance Commissioner, a program to save Rhode Islanders $8 million in healthcare costs since 2018. And I'm also the interim chair of the Protect Our Healthcare Coalition. Also with me today are, and I'll let them introduce themselves when they come up to the podium, Nina Harrison, the Policy Director from the Economic Progress Institute. We hope to be joined by Chair Josh Miller, one of our Senate sponsors, by Representative Gene Speakman, by Representative Rebecca Kislak, by Tara Hayes, an effective consumer and a RIPIN peer, by Maureen Maigret, an advocate of the Senior Agenda Coalition, and by Marjorie Waters, a community organizer with the Rhode Island Organizing Project. So thank you all for taking some time to come and share your stories with us here as well. The Protect Our Healthcare Coalition was founded in 2016, and its initial charge was to protect the improvements of the Federal Affordable Care Act due to the ongoing threats at that time to the Affordable Care Act's longevity and fears that the protections that it had advanced that really helped Rhode Islanders access important and meaningful healthcare coverage could go away and people would be left in a much worse place than they had been. On that front, the Protect Our Healthcare Coalition is very happy to say that we've had success with a lot of our legislative partners, some of whom are in the room with us today, in enshrining a lot of those protections in Rhode Island state law through legislation, including the requirement that all plans issue coverage to anyone who applies, the prohibition of pre-existing condition exclusions where people could not have certain health coverage or health conditions covered because they existed before they entered the plan. The requirement that all plans must cover essential health benefits. You couldn't have skimpy plans that leave out massive gaps in what they covered. The requirement that all plans cover preventive services free of charge. And a few years before that, the requirement that women could not be charged more simply because they were women with relevant gems. We have expanded since then beyond our initial charge to expand Rhode Islanders' access to affordable, meaningful, and high-quality health care, in a lot of ways kind of taking a step beyond that baseline of the Affordable Care Act as established at the federal level. And why we're here today is kind of in line with that. We've seen the success that we've had in establishing that baseline from the Affordable Care Act. But we can go further in Rhode Island, and through part of a recent Protect Our Healthcare Coalition strategic planning process, the thing that we kept hearing over and over again from community members was that even with all of the work that we've done so far, healthcare is still not affordable. Health insurance premiums go up every year, out-of-pocket costs go up every year, things like deductibles, co-pays, the cost of your prescriptions, and they're unbearable for a huge number of Rhode Islanders. These costs really affect people across the board no matter what your income is, but their impacts are borne the hardest by people who are just over the Medicaid income limit, so they can't get free health insurance coverage through Medicaid. But they can't afford these increasing costs. And because of these rising costs, we're seeing the perpetuation of long-standing inequities in access to care and in the care outcomes that people face. In addition to the obvious financial burdens that people face by these increasing costs, nationally, 34% of people with lower incomes below $40,000 a year report that their family delayed care because of a serious health care condition because of cost, which is double the rate of people with higher incomes. While there's no simple solutions for this, we really need to stand up and take real action to head off the exploding affordability crisis. The Affordable Care Act in Rhode Island helped many Rhode Islanders get health coverage, sometimes for the first time, by expanding Medicaid and by creating affordability programs with lower premiums and out-of-pocket costs. This helped reduce our uninsured rate in Rhode Island by nearly 75% in the years since the Affordable Care Act was established in 2012. And in 2022, we had less than 3% of Rhode Islanders uninsured, which is one of the lowest uninsured rates in the nation. So go us. In addition to the advances that we've made in the commercial market, we've also seen how Medicare and programs to provide additional benefits for Medicare enrollees can help with low-income Medicare enrollees navigating Medicare costs. But in both the commercial coverage sector and in Medicare coverage, too many people struggle with high and rising healthcare costs. And insurers and Medicare continue to shift more and more of these rising costs onto consumers through things like higher monthly premiums for their health insurance, through higher deductibles, through higher copays, through higher drug costs. Now, in response to this, the Protect Our Healthcare Coalition has launched a story bank that's available on our website. I'll give you the URL. It's protecthealthri.org. And we encourage you or your families or your friends, your neighbors, your constituents to share their stories with us through that story bank. But I want to take a second just to tell a story that we've received already through that. Shared with us by Sean from Cumberland. Sean was on Medicaid during the COVID-19 pandemic. A lot of folks had lost coverage at some point during the pandemic, and pandemic-era restrictions meant that the state couldn't terminate anyone's coverage. But recently, when those redeterminations started back up, he lost his Medicaid. He enrolled in a plan through HealthSource Rhode Island. This was a paid commercial plan, and he was eligible for some financial assistance. However, even with that financial assistance, his costs are still very high. He has several health conditions. That means that he has 16 prescriptions that he takes every month. Even though some of those copays are very low, $5 to $10, that all adds up, and he's concerned that even with the lower cost that he has through the benefits that he gets from the financial assistance, he's still in a worse place than he would be if he worked a license to keep his Medicaid. So he's considering cutting back on his hours, working less, going part-time, and he works in the mental health arena. If he reduces his workload, that could have a negative impact on the people with mental health crises that he's serving. But he's worried that he has no other options to keep his head above water financially. In response to that, the Protect Our Healthcare Coalition has worked with our sponsors, that's Chair Josh Miller and Rep. June Speakman, to establish the Individual Market Affordability Act. That bill would essentially set up programs in Rhode Island, and I'll talk a little bit more about that in just a second, to address some of these affordability challenges that people right over the Medicaid income limit would face. But I want to take a second just to see, is Chair Miller here? No, he's not. So we worked with Chair Miller and Rep. Speakman to draft this legislation, and that would set up a healthcare access affordability fund that could be used to drive down out-of-pocket costs and provide additional premium assistance for low-income Rhode Islanders who are purchasing their coverage through HealthSource Rhode Island. What this program would do is it establishes a funding mechanism that would impose a 2% premium assessment on health insurance carriers in the state that would then take those funds along with other federal funds that we're looking to identify and that the state could apply for waiver assistance to obtain. Put that into a healthcare affordability fund that a established healthcare affordability board would take that fund and put it towards higher cost sharing reductions and premium assistance for Rhode Islanders who are above the Medicaid income limit but can't afford their health insurance, can't afford their health care as it stands right now. This is a program that is based very closely on existing and successful models that Colorado, Washington State, and Massachusetts have all established. This program, we're hoping, would raise about $20 million that could be put into that fund in the first year. And that could really help address those out-of-pocket costs that are rising every year for people who really can't afford their coverage. But I want to turn it over to Representative Speakman to speak a little bit more about why this bill is important and how we can move it forward.
Good afternoon, everyone, and thank you for coming. I want to thank the Coalition for all of their work on this. Karen is relentless. And Shamus has the gift of being able to explain extremely complicated healthcare financing concepts to someone like me, and I really appreciate that. Thank you, Shamus. I want to thank my colleagues from the House who are here, Rep. Agello, Rep. Kislak, from whom you will hear in a moment. I saw Rep. Cruz, Rep. Morales, Representative Bennett. I don't know who else is here, but thank you all for coming. And I am proud to sponsor the Individual Marketplace Affordability Act because it provides relief to a group of Rhode Islanders who find themselves having a particularly difficult time buying quality, affordable insurance coverage. We all know, as Shamus said, that out-of-pocket costs for health care are rising as premiums and deductibles rise and co-pays increase. HealthSource RI reports a 21% increase in these costs between 2020 and 2022, the highest increase in out-of-pocket spending since the survey began in 2012. This creative and innovative and tested in other states program is designed to keep these costs down for low and moderate income Rhode Islanders who buy their coverage on HealthSource RI. These are individuals and families who are transitioning, like Sean, from Medicaid to the marketplace as a result of the post-pandemic Medicaid unwinding. These are families who earn a bit too much to qualify for Medicaid, but are having difficulty affording even the high deductible plans that are available in the marketplace. These are for families who do not have employer-provided insurance and who are on their own to buy a policy on the exchange. It's a bit easier for them right now because of enhanced federal premium tax credits that keep their costs low for now. But this program, they will face an affordability cliff when these enhanced tax credits sunset in 2025. I never thought I'd be grateful for anything that happened during COVID, but we saw some programs implemented that actually helped people get health care that was affordable or even in many cases free, and many of those things are going away now, and we're going to have to figure out how to fill in that gap. And that story bank, I know Sean's story, but I'm going to go look at the other ones and continue to be grateful for your work. When this enhanced program, the tax credit program, goes away, these Rhode Islanders will be faced with a sudden increase in premiums that may push their policies out of reach or force them to buy high deductible, limited coverage policies. This program will provide subsidies for these families so they can purchase better coverage for themselves and for their children. We need to do all that we can to ensure that all Rhode Islanders have access to quality, affordable health insurance coverage, and this bill is a big step towards the goal. So thanks to the Coalition for bringing it to us. Thank you all.
Thank you, Representative Speakman. I'll just put a point on a couple of things that you mentioned here. As Rep. Speakman mentioned, there were certain things that were passed during the COVID-19 pandemic, things that included the preservation of Medicaid coverage for many Rhode Islanders and the extension of premium assistance to a large number of Rhode Islanders who otherwise wouldn't be eligible. I'll leave you with just a couple of numbers, one of which is that currently no one under those premium assistance expansions, no one is paying more than 8.5% of their income for a baseline plan through HealthSource Rhode Island. These are folks who aren't offered coverage through work, aren't eligible for Medicaid, aren't eligible for Medicare. So this is kind of their backstop, and that keeps their coverage relatively affordable. It's still 8.5% of your income, still can be a lot of money, but that is much lower than it was before and much lower than it could be after. People say a couple who is 64 years old about to go on Medicare, who makes just about 4 times the federal poverty line, that's about $82,000 a year for the couple, they would pay about 34% of their income for coverage without that additional premium assistance. That is unbearable. And so this is one of the things that we're trying to address with this expansion of the individual health insurance assistance program with the assistance of Chair Miller and Rep. Speakman, and so we urge you to support that. I'm going to shift gears for a second to another program that's important to the Protect Our Healthcare Coalition this year and part of the agenda for our campaign for healthcare access and affordability, and that is the prohibition of the Affordable Care Act's, the prohibition in the Affordable Care Act of annual and lifetime limits in health insurance coverage. Now, most of us probably haven't experienced this in more than 12 years. Some of us have never experienced this buying coverage, including myself. But before the Affordable Care Act, most plans in Rhode Island, more than 50% of plans in Rhode Island, had lifetime limits on coverage. Many other plans also had annual limits on coverage. And what that means is that somebody who has very high health expenses, now these numbers are higher than most people would have covered in a year, but certainly could be exceeded by a bad illness, an accident, childhood cancer, a bad diagnosis, frequently $1 million or $2 million total, would essentially become uninsurable. They would incur those expenses, and then their health insurer could say, you're too expensive, we're never going to pay another dime for you. This is obviously a problem. What this would require is that people would become uninsurable with one insurer. They'd have to find another insurer to take them on. If they were lucky enough to do that, they could very easily work themselves through all the insurers offering coverage in a state like Rhode Island. And then they would spend all of their financial resources, and once all of their financial resources were spent, they'd end up on Medicaid, and the state would bear the burden of all of their costs. The Affordable Care Act got rid of that. Under the Affordable Care Act, no health insurance plan can be offered that has an annual or a lifetime limit. And that's been really important for a lot of Rhode Islanders in maintaining their financial stability and their access to the care that they need. But I want to turn it over to Tara Hayes, who is an affected consumer whose family would have been affected by annual and lifetime limits, and is also a RIPIN peer, to talk a little bit more about their experience.
Thanks, Shamus. First off, I do want to thank longtime friend Rebecca Kislak, Representative Kislak. She has always been a supporter of RIPIN and families. I also want to thank the other sponsors of the bills that are being heard today, and Karen and Shamus for leading the Protect Our Healthcare Coalition. When it comes to lifetime limits, as a mom to a child with significant medical needs, it's extremely scary to think about that. If insurance companies were able to institute annual lifetime limits on care, my oldest child would already be uninsurable, and he's only 16. Andrew was born in 2008, and he spent 103 days in the NICU. Due to his length of stay, we were fortunate enough that Medicaid took over as his payer of care. At that time, the ACA was not in place. Due to the intensity of his needs, he continued to qualify for Medicaid at home. If I had had to add him to my commercial insurance at that time, he may not have had access due to the cost of care during his stay and due to all of his pre-existing conditions. Rhode Island has ensured that pre-existing conditions are no longer a barrier for accessing care. And even if there are changes at the federal level, we in Rhode Island also need to ensure that families and individuals with special health care needs are not discriminated against by allowing insurance plans to institute annual lifetime limits. Between 2022 and 2023, Andrew was in the hospital more than twice, but for a total of about 75 days. Those total of 75 days cost over $500,000 right there. So as you can see, in 2 years of his life, he could have instituted these lifetime limits and then be uninsurable. And as it is, I feel like there's a limited number of providers that care for those with complex needs. So the implementation of lifetime limits would set us back decades, and it would really force families to go bankrupt in order to get Medicaid, like Shamus said, or send their loved ones to institutional care facilities, which again would set us way back in where we are today. So, I just want to tell everyone today, my son and my family are thriving, as are many others like us, because we have these safeguards and protections in place in Rhode Island. So I really hope that Rhode Island will continue to show our support for the most vulnerable populations and take lifetime limits off the table. Thank you.
Thanks for that, Tara. I'm going to turn it over to Representative Kislak to talk a little bit more about what this bill would do and how it would interface with the existing prohibitions on some of the Affordable Care Act protections that have already been established.
Great. Thank you so much, Shamus and Tara, and everyone who is here. This is a great team right here, and lots of us have been working together for affordable, accessible, high-quality health care for decades, even throughout various roles together as we all travel together in Rhode Island health policy world. So I'm grateful to all of you for being here and for working together on these really important issues. I met many of you when the Affordable Care Act was getting passed in Congress, and so Some of us remember what it was like in the bad old days when folks really did run through their annual or lifetime limits, and we know that it could take one bad accident or one very sick little kid. I remember the first time I met the family of a 2-year-old who had run out of his whole lifetime insurance, $2 million by the time he was due. I was shocked. I didn't know that that was possible. And that was when I started paying attention to this very issue. So I was grateful for the Affordable Care Act. I have since learned from Tara and others that it is not uncommon. Many of us are fortunate that it is not an issue in our own personal lives, but there are a lot of people out there who this affects. I think, on my walk here today, I was thinking, I don't think people under 30 or 35 even know that this used to happen. So we're raising a generation of people who expect that when they have, as they should be able to, that when they have health insurance, they will have health insurance and it will take care of them. No matter what happens, that it will take care of their children, no matter what happens. And so this bill, I'm really proud to sponsor. It's the last important piece of codifying the Affordable Care Act here in Rhode Island so that we protect Rhode Islanders no matter what happens at the national level. It goes together with some other pieces that we've passed and codified already. And so this is the last piece. It's really important. We cannot go back to the bad old days. And that's why I think this is so important. I'm really glad this is a part of this package. I love the whole package. I love that we're talking about kind of super subsidies for health insurance, which is one way to make it more affordable for more people. There are a lot of really important things in this package. I'm grateful to all my colleagues here from the House who are here, who Rick Speakman already named. I want to point out that there are many champions also on the Senate side. They are right now at a memorial service, I think, for Senator Lombardo. So our hearts are with the Senate on their loss, and that is why many of them who really wanted to be here could not be here. And yeah, so thank you all. What a great healthcare team. Thank you.
Thank you, Representative Kislak. And just to end on that, I want to thank all of the sponsors and the champions that we've had in the legislature that have helped us so far driving to codify the important protections of the Affordable Care Act in Rhode Island state law. The Affordable Care Act is working in Rhode Island. We're not there yet, but it's really important that we take all of these important protections and make sure that people can still continue to experience the care that they've grown accustomed to over the past more than a decade. And that includes Representative Speakman, Representative Kislak, Chair Josh Miller, and many others in the room as well. At this point, I want to turn it over to Nina Harrison, the Policy Director for the Economic Progress Institute, to take us through the rest of the campaign agenda. Thanks so much.
Thank you, Shamus. My name is Nina Harrison. I'm the Policy Director at the Economic Progress Institute. The Economic Progress Institute is a research and lobbying organization that fights for policies that improve the lives of low and modest income Rhode Islanders. And so I'm going to talk to you, Shamus mentioned that Rhode Island has one of the lowest uninsured rates in the country. Again, yay us. And part of that is because of our strong Medicaid and Medicare enrollment. And so in Rhode Island, nearly half of all Rhode Islanders access health care coverage through our public programs, Medicaid and Medicare. That's approximately 470,000 people, nearly half of our 1 million population. Almost 120,000 Medicaid members are children under the age of 18. So these programs are really significant to making sure that Rhode Islanders can access affordable and quality health care. And while we've done a great job with that enrollment, these programs need to be expanded, and we need to help people afford their out-of-pocket costs, which they have even on Medicaid and Medicare. It's critical that we find ways to ensure that this coverage is meaningful and not just a name. And as many of us know, just by living in this state, the cost of out-of-pocket of costs for insurance has increased at a much faster pace than have wages in this state. And so people are really struggling, which often causes them to choose between paying their bills and getting their medication, or even delaying seeing a doctor or getting that treatment, which could make their conditions much worse. And so here, to talk about one of my favorite policies on our agenda this year is Maureen Maigret from the Senior Agenda Coalition, who is leading the effort on a bill that would expand eligibility for the Medicare Savings Program and really help some of our most vulnerable Rhode Islanders pay for their out-of-pocket costs. So here's Maureen Maigret to talk more about this bill.
Good afternoon, everyone. I'm really delighted and pleased to be here to join with so many colleagues who are interested in supporting better access and better affordability for health care, which is really an equity issue for so many people in our state. I'm going to talk about a bill, as Nina said, thank you, Nina, for expanding the Medicare Savings Program. Those bills are House Bill 7333. And that was sponsored by Representative Karen Alsate, who's been able to join us this afternoon. Thank you, Karen. And I think I see a couple of co-sponsors. I know Representative Agello's been behind this for many years, and I thought I saw someone else with Representative Cruz here, and if I'm missing anyone, I apologize. But the bill was also sponsored in the Senate by Senator Sandra Cano. She's not able to be here, as was mentioned, because there is a memorial event for former Senator Lombardo. But I know she would have been here if she could have. The Senior Agenda has been working for well over a decade to promote policies and legislation that improve the quality of life of our older population. And this is not our first rodeo at this bill. We've been doing this for a couple of years, and I know Representative Jello's been helping us for a couple of years, and last year Representative Alsate sponsored a bill. But we have a new bill this year. It's an innovative bill, and it's modeled upon a law that was passed in New York. So it's a very different bill than in the past. Now, some of you who are not old enough to be on Medicare might say to yourself, well, I thought if you were on Medicare, everything's cool, you get everything paid for. I see some head shaking here. Well, that's just not the case. Medicare, well, maybe not as complicated, Shamus, as Medicaid, but it's very complicated. It has different parts. It has Part A, Part B, Part C, and Part D. And it has co-payments and deductibles, and it has premiums. In fact, research shows that the average out-of-pocket cost for someone on Medicaid, so it would be a person 65 and older, or a person who has been on disability for 2 years and qualifies for Medicaid, for Medicare, their out-of-pocket costs are a little over $6,600. So imagine if you're low income and you're not eligible for Medicaid in Rhode Island, because Medicaid in Rhode Island for older people and older adults with disabilities has very restrictive financial requirements, more so than the other populations. So what does that mean? Oh, and I forgot to tell you, there are big gaps in Medicare. Medicare doesn't pay for hearing aids. It doesn't pay for most eyeglasses. It doesn't pay for any dental care. And it doesn't pay for long-term care. So think about those big gaps. So what does that mean for lower income people on Medicare who are not eligible for Medicaid? It means that they're having trouble affording their health care. It means that they may be delaying going to the doctor. They may be avoiding getting a treatment that they need because of a big copay. I remember my mom was in elderly housing, and I remember her neighbor had cancer, and she told me she doesn't go to the oncologist because she can't afford the $40 copay. That is sad. I told you that out-of-pocket costs could be well over $6,000. on Medicare Advantage, we have a lot of people on Medicare Advantage, they could have out-of-pocket costs before those costs are shut off as much as $8,000. So what does the Medicare Savings Plan do? It was established way back in the 1980s by Congress, and it's been changed over the years. They've added different features. The most recent feature that they have added is an upper tier in which the federal government pays for all of the premiums for Part B. Those amount to $2,100 a year. For some of the other very low-income people, it pays for the co-payments and the deductibles. So what we are doing this bill, we're following what the state of New York did. We're increasing the income eligibility from the current high level, which is only a little over, and think of this, $20,000, not much money. We are increasing it to 186% of the poverty level. That is a little over $28,000. What will this do? It's a win. If our calculations are correct, and I think they are, it could bring in 17,000 more low-income Medicare enrollees into that high level of care. It would pay for those premiums. Plus, another win, it would make them qualify for some federal program called the Extra Help Program that helps pay for prescription drugs, saving them even more, in some cases, thousands of dollars, money that they can use to pay for basic necessities like food and rent and other basic needs. And the really good part of this is the federal government would pay those premiums for everyone who is newly eligible. That will bring into the state of Rhode Island millions of dollars that will go right back out into the economy, because at that low income level, you're not going to put that money in a CD. You're going to use that money to pay your utility bill when it's due, or buy food for yourself and if you have a partner. So we think it's a win-win. It's a win-win for the people who will be helping, and it will be a win for the state of Rhode Island. And at this point, I'm delighted to call up to the podium my colleague, Marjorie, who's going to give us some real-life examples of what this means for very few people here in Rhode Island. Thank you very much.
Good afternoon, everyone. It's wonderful to be here and see so many people in attendance. My name is Marjorie Waters, and I work for the Rhode Island Organizing Project as a community organizer. I've been doing this for over a decade now, and one of the most important bills that's come along is the Medicare Savings Plan. Not easy to understand, but once you do, oh boy, it can make such a difference in people's lives. That when you're living on a fixed income or disability, I've talked to people who have $30, if that, left after a month. There are no dollars for co-pays. There are no dollars for eyeglasses or other care. So they simply go without. With the Medicare Savings Plan picking up and the lien case, which is your premium, that adds $170+ a month back in people's pockets. Now, what does that mean? I'd first like to talk about a young woman who's in her 50s. She's disabled. She does have the Medicare Savings Plan. And what she talked to me about is what it means to her to have it. She said, I couldn't survive without it. I couldn't live where I'm living. I couldn't see the specialists I need to see because of co-pays. She said, I would be a much sicker individual and potentially homeless because she couldn't afford the rent. That is how slim the margins are that people are working with. We can't imagine what it would be like to not be able to afford a $30 copay. It is a reality for many, many people. The second person I'd like to talk about, her name is Dolores, and she's an older senior. She's in her 80s. She currently doesn't qualify for the Medicare Savings Plan. She's just over the limit. But by passing these bills, it will offer her that extra financial wiggle room that she really needs. One of the saddest things that she told me is she has not seen her daughter in years in Florida because her daughter cannot afford to fly her there and she cannot afford to fly. She is so excited that with the passage of a bill like this, she may finally get to see her daughter after 20 years. So I just want to impress upon you, there are many people whose lives will be changed because of this bill, and I implore it to be passed. Thank you.
Thank you so much, Marjorie and Maureen. Now you all know why this is one of my favorite proposals of this year. The federal government's paying for a lot of it, and it would really go to help thousands of Rhode Islanders who really could use that money. So you've heard about our top tier priorities, and finally, I would like to talk to you about the rest of the work that remains to be done. Because while those are important, we all know that there is a lot of important work to do. So I'd like to talk to you about some of the other things that we hope to accomplish this year. First is HB 7103, which is Rep. Shalcross Smith's bill to protect against medical debt. That's also endorsed by the Leukemia and Lymphoma Society. That bill would prevent harmful medical debt collection practices, including placing liens against a patient's home and garnishing a patient's wages. It would also limit interest rates to no more than 3% that can be charged on medical debt. And it would prohibit medical debt from being reported to credit reporting bureaus. And also, this would have an equity impact because Black and Latino households tend to carry much more medical debt than their white counterparts. So this would be a really important protection for families and people in Rhode Island dealing with illness and medical debt. Next, we have to invest in Medicaid and address workforce shortages by increasing reimbursement rates for providers. I'm sure many of you have heard stories about people unable to get appointments because providers are short-staffed, or even providers leaving because of low wages. And so there are proposals this session for increased funding for Medicaid to address these workforce shortages and increase provider rates. And I think that's not only important so that we can all get to our medical appointments, but so that people can make the wages that they deserve in the healthcare field. And to remind you that almost half of Rhode Islanders are on Medicaid and Medicare, so we really do need to support these programs that are supporting Rhode Islanders. We're also endorsing continuous health care coverage for children from birth through age 5. Those are critical years of development, and I know our friends at Kids Count and some other coalitions are also working hard on this. And last but not least, we need protections for those seeking and providing gender-affirming care. As we know, both doctors and patients have been under attack throughout the country, and we want to make sure that here in Rhode Island, our residents, the people who live here and who seek care here and provide that care are all safe and able to do their jobs and receive the care that they need. This coalition has made tremendous progress for the health and well-being of Rhode Islanders long before I joined. This is my official 1-year mark on the job at EPI. It's my pleasure to work with this coalition to try to make sure that Rhode Islanders have access to affordable, quality health care, and that we can make that better each and every year. I look forward to working with you all to safeguard the progress that has been made. I thank the representatives and the advocates in this room, and I would like to invite you all to join us after this event to pass out the fact sheets that are at the back, to try to engage with other representatives in the building, to tell them why these policies matter to you and why Rhode Islanders should value accessible, affordable, meaningful health care. So thank you all for being here, and I hope you'll join us as we lobby for these bills.